All right, so let's talk about sleep.
Okay.
Have you ever thought about, like,
Yeah,
how much time we actually spend doing it?
for sure.
We spend a third of our lives,
It's a lot.
yeah, asleep,
Yeah.
which is a huge amount of time,
Wild when you think about it.
right?
Like a third of your life.
Yeah, and it just makes me wonder if people really, truly consider, like, how important that time is
Mm.
for their well-being and their health.
Yeah, I think we kind of take it for granted sometimes.
Yeah, for sure.
It's like this thing in the background until you don't have it.
Right, exactly.
Then you're like, oh,
Exactly.
okay, maybe I should have been paying more attention.
So that's what we're going to be talking about today in this deep dive into the science of sleep.
Awesome.
And we're really going to be focusing on both mental and physical health as it relates to sleep.
Okay.
We're using two sources here.
Okay.
First, we have a 2011 report from the Mental Health Foundation called Sleep Matters, the Impact of Sleep on Health and Well-Being.
I like that title.
Yeah,
It's very direct.
it is.
Yeah.
Gets to the point. And then we have a more recent one, a 2021 position statement from the American Academy of Sleep Medicine,
Okay.
from the Journal of Clinical Sleep Medicine, and it's called Sleep is Essential to Health.
So, pretty clear message there.
Very much so, yeah.
It's essential. We're not beating around the bush.
No.
We need it.
Right. And so if you've ever been, like, overwhelmed with all of the sleep advice out there,
Mm-hmm.
this is really for you, because we're going to try to cut through that and get to, like, the core reasons why sleep matters.
Okay.
What happens to you when you don't get enough sleep?
Makes sense.
We're going to try to simplify things and make it very digestible.
Yeah, I think that's key because there's so much noise around this topic.
Right, and a lot of conflicting information as well.
Exactly.
Oh.
So it's good to have a clear framework.
So today our mission is to explain why sleep is as essential as eating and drinking and breathing.
Big claim,
It is.
but I think we can back it up.
I think we can too.
We'll see what the research says.
Yeah, for sure.
So starting from the very basics,
Yeah.
why is sleep so fundamental?
Well, both of our sources make it very clear that sleep is absolutely essential.
Right.
The Mental Health Foundation calls it an essential and involuntary process,
Mm-hmm.
and they compare it to diet and exercise.
So it's up there.
It's right up there with those things.
The essentials.
Yeah, and then the AASM goes so far as to say that sleep is essential to health.
Pretty strong statement.
Yeah,
No ambiguity there.
not at all.
You need sleep to be healthy.
Exactly. And to further underscore this point,
Okay.
healthy people, 2030,
Yeah.
a national program for public health goals has included sleep-related objectives
Oh, wow. So it's
being recognized at that level.
It is, yeah. It's
Yeah.
really being taken seriously.
That's great to hear.
Yeah, so sleep is clearly not just a time when we, like, turn off. The Mental Health Foundation says that our brains are actually very active.
Oh, really?
Yeah.
I thought it was like downtime.
Well, it's not.
It's actually processing information,
Oh.
consolidating memories.
So it's like working in the background.
It is. Yeah, very much so.
That's fascinating.
And they also say that maintenance processes happen during sleep.
What does that mean exactly?
Well, it's essential for daytime functioning.
Okay.
So it's like,
Makes sense.
it needs to happen so that you can function.
So it's like a car getting a tune-up.
It is, yeah. Or like a computer
Okay.
defragging.
Yeah.
So then there's also, we hear about different types of sleep.
Right.
And the Mental Health Foundation explains that there are different stages.
Mm-hmm.
And it's not just about like how long you sleep.
Right.
It's about cycling through all of these stages
Okay.
and getting enough of those.
So like deep sleep?
Yeah, especially the deep sleep.
Yeah, that's when you really feel.
That's the one that's really restorative.
When you wake up and you're like, wow,
Yeah, you feel good.
I'm ready to go.
Exactly.
Yeah.
So what happens when we don't get enough sleep?
Yeah, that's the question, isn't it?
Well, we usually know, right?
Yeah.
We feel it pretty quick.
We've all been there.
Yeah. The Mental Health Foundation lists fatigue,
Mm-hmm.
sleepiness, sleepiness,
Obviously.
poor concentration, memory lapses, irritability,
Yeah, the whole package.
all the fun stuff.
The classic sleep-deprived symptoms.
And they also say up to a third of the population might experience insomnia.
That's a lot of people.
It is, yeah. It's a
Yeah.
huge amount.
Wow.
And they go on to explain that it can really affect your mood, your energy levels, your
Right.
concentration,
Right.
your relationships, and your daytime functioning.
Yeah, it makes sense when you think about it.
Yeah, it makes
If you're not sleeping well,
Yeah,
everything's harder.
everything is.
Your fuse is shorter.
Yeah,
You're just not at your best.
right.
And then the AASM gets into some of the more serious long-term consequences
Oh, yeah?
of sleep deprivation.
Like what?
They talk about an increased risk of accidents and injuries.
Oh, wow.
And not just like little things.
We're talking workplace accidents.
Mm-hmm.
motor vehicle crashes.
That's scary.
Yeah, it's serious stuff.
Because you're basically impaired.
Exactly.
Right.
You're not functioning at your full capacity.
You're not making good decisions.
Right. And it's,
Uh,
comparable to being under the influence in
Right.
terms of your reaction time and your judgment.
That's a really good point.
And then there's the link between chronic insufficient sleep
Okay.
and an increased risk of mortality.
So like dying younger.
Yeah, essentially.
Wow.
It's a pretty big deal.
It is. Yeah. And they also say that it contributes to medical epidemics,
Oh, wow.
like cardiovascular disease,
Okay.
diabetes, obesity, cancer,
So it's not just,
all the big ones.
yeah, it's not just about feeling tired.
Right.
It's about
It's about your
serious health consequences.
lifespan. Yeah.
Yeah,
It's pretty crazy.
it is.
So now that we know how important it is, what is healthy sleep?
Yeah, what does that even mean? Right, because it's more than just how many hours you get.
It is.
The AASM says it's also about quality timing regularity and the absence of sleep disorders.
Okay, so it's multifaceted.
It is, yeah.
It's not just one thing.
That's a whole bunch of things.
We got to look at the whole picture.
Right. And the Mental Health Foundation says that everybody's different.
Right.
There's no magic number of hours.
That works for everyone.
That works for everybody, yeah.
Yeah, that makes sense.
So they talk about something called sleep drive,
Sleep drive.
which is that feeling of like, I need to go to sleep.
Okay.
Like when you've been awake for a long time.
So it builds up.
It builds up, yeah.
Longer you're awake.
Yeah, like hunger.
Yeah, okay, I get it.
And then they also talk about sleep pattern,
Okay.
which is the regularity and the timing.
So like going to bed and waking up at the same time.
Exactly.
Yeah.
That really helps.
Works too.
So when it comes to like general recommendations, the AASM and the Sleep Research Society both recommend 7 or more hours per night for adults.
7 or more.
Yeah.
Okay.
And the National Sleep Foundation says 7 to 9
For adults.
for adults.
Yeah.
Yeah. And older adults, maybe 7 to 8.
So a little bit less.
Yeah. And then obviously children and adolescents
Okay.
have different needs.
It makes sense. Different stages of development.
Right. But the AASM says a lot of people aren't meeting these recommendations.
Really?
Yeah. They cite CDC and Maternal and Child Health Bureau surveys.
Okay.
And they say 34.1% of children, 74.6% of high school students,
Wow, that's a lot.
and 32.5% of adults
So a big chunk of the population
Yeah.
is not getting enough sleep
not getting enough sleep.
regularly.
Yeah. And so the question is, are we as a society doing enough,
To address this,
Yeah.
given how important it is.
given how important it is? Yeah.
Then what does the AASM say?
Well, they say that while it's great that things like Healthy People 2030
Mm-hmm.
are including sleep-related objectives,
Right.
there's still a lot that needs to be done.
Like what specifically?
Well, they say that we need more education.
Okay.
They think that sleep education should be taught from K through 12 through college, even in medical schools.
Yeah, because if doctors aren't educated about it,
Right.
how are they going to help their patients?
Exactly. And they point out that medical schools only spend an average of 2.5 hours on sleep education.
That's not a lot,
It's not a lot at all.
especially for something so important.
Yeah. And they also think that in clinical practice,
Yeah.
doctors should be routinely asking their patients about their sleep habits,
Makes sense.
and that hospitals and long-term care facilities
Yeah.
should be trying to optimize sleep conditions.
So like making sure it's quiet and dark
Right.
and the temperature is comfortable.
Yeah. All those things.
Yeah.
They also say that public health promotion for sleep is really lacking
Interesting.
compared to other things like nutrition and exercise.
Right, because we see so many campaigns for those.
We do. Yeah.
Eat your vegetables.
Yeah.
Get your exercise.
Yeah.
But we don't really hear.
Not so much about sleep.
Yeah.
And they point to research
Okay.
that shows sufficient sleep is linked to a reduced risk of cardiovascular disease.
Oh, wow. So it's as important as those other things.
Right. And even a study,
Okay.
a Dutch cohort study,
Mm-hmm.
showed that getting enough sleep on top of the other healthy lifestyle factors further reduced the risk of cardiovascular disease.
So it's like an added bonus.
It is.
On top of everything else.
Yeah. And there was another study
Okay.
that showed cardiovascular health scores that included sleep were actually more strongly associated with cardiovascular disease outcomes than the traditional American Heart Association's Life's Simple 7.
Wow. So it's even more important than some of those other things.
Yeah. And then there's research that says getting enough sleep might actually be more important for long-term health
Then what?
than things like eating breakfast.
Really?
Yeah.
I always hear about how important breakfast is,
Yeah.
but sleep might be even more so.
It seems that way. Yeah. And then for young adults,
Okay.
they found that sleep quality was the strongest predictor of their mental health.
So it's really crucial for that age group,
It is. Yeah.
especially with all the stress they're under.
Exactly.
Schoolwork, social life.
Yeah.
Makes sense.
And finally, the AASM talks about the role of sleep in the workplace.
Okay. Interesting.
Yeah. And they say that employers should actually be promoting healthy sleep habits.
Like how?
Well, they talk about education,
Okay.
allowing for naps.
Oh, that's at work.
Yeah, like short naps.
Interesting.
And they talk about fatigue risk management systems.
So like trying to prevent people from getting too tired.
Exactly.
Yeah.
Yeah. And they also say that, employers could benefit from this.
How so?
Well, reduced absenteeism,
Okay.
presenteeism.
So people are actually showing up and being productive.
Exactly.
Yeah.
Makes sense.
So everybody wins.
Yeah.
And then finally, both the Mental Health Foundation report and the AASM position statement say that more research is needed.
The AASM calls for more research into the mechanisms that connect sleep and health.
So really understanding how it all works.
Right. Yeah. And then they also say we need to evaluate interventions.
So like different ways to improve sleep.
Exactly.
Yeah.
And see what works best.
Okay.
And then finally, they say we need more research on sleep health disparities.
So like differences in sleep between different populations.
Exactly.
Yeah.
Okay.
So what would you say is like the main takeaway here?
I think the biggest takeaway is that sleep is essential.
Yeah.
It's not a luxury.
It's not a luxury.
It's a necessity.
It's a biological necessity.
Like eating and drinking.
Yeah.
And breathing.
Yeah. And if you don't get enough sleep,
There are consequences.
there are serious consequences.
Both short-term and long-term.
Exactly.
So we really need to prioritize it.
We do.
For our own sake and for the sake of society as a whole.
So for you, the listener,
Yeah.
what can you do to prioritize sleep?
Yeah, think about your own sleep habits.
Mm-hmm.
How are you doing?
Yeah. Are you getting enough? Are you getting enough? Are you getting good quality sleep?
Yeah. How's your sleep hygiene?
Yeah. All those things.
Yeah. And we want you to think about
Yeah.
how prioritizing sleep
Mm-hmm.
might affect your life.
Like your daily life.
Yeah.
Your mood, your energy, your concentration,
Yeah.
your long-term health.
Yeah.
Everything.
And since we spend a third of our lives sleeping,
Yeah.
shouldn't we be putting more effort into understanding it?
Absolutely.
Yeah, I think we should. And maybe the question is,
Yeah.
what can you do tonight
To start prioritizing your sleep.
to make a change?
Yeah. Even a small change
Yeah,
can make a big difference.
to make a big difference.
in the long run.
Exactly.
So think about that.